How to manage potassium intake with kidney disease. Managing potassium intake with kidney disease is like walking a tightrope. You want to keep your potassium levels balanced to avoid health problems, but also want to enjoy nutritious foods. The key is understanding that each person's needs are different, depending on how well their kidneys are functioning and their overall health. Potassium is vital for muscle and nerve function, but when kidneys struggle, excess potassium can build up in the blood, leading to serious heart rhythm issues. That's why careful management is so important. First, it's essential to have personalized goals for potassium intake. Doctors now recommend tailoring these goals based on your blood tests and health status. Instead of a one-size-fits-all limit, your healthcare team will work with you to keep your potassium within a safe range. For example, if your blood tests show high potassium levels, your doctor might suggest reducing your intake. If levels are normal, you might be able to enjoy a wider variety of foods. In early stages of kidney disease, potassium levels are usually well controlled because the kidneys still remove excess potassium effectively. During these stages, a typical intake might be around 2,000 to 4,000 milligrams per day, depending on your kidney function and medications. As kidney disease progresses, especially if you are on dialysis, stricter limits are often necessary, sometimes around 2,500 to 3,000 milligrams daily, to prevent dangerous hyperkalemia. Monitoring your blood potassium regularly is crucial. Your healthcare provider will order blood tests to check your levels and adjust your diet accordingly. If your potassium is too high, your doctor may recommend reducing foods rich in potassium. But it's important to remember that many healthy foods like fruits, vegetables, legumes, and nuts are naturally high in potassium. These foods provide fiber, vitamins, and minerals that support your overall health and may even slow kidney disease progression. There are ways to prepare high-potassium foods to make them safer. For example, soaking and boiling vegetables can help leach out some of the potassium, reducing its content. Working with a dietitian can help you identify safe portion sizes and food choices that fit your individual needs. Sometimes, medications called potassium binders are prescribed. These help control potassium levels and can allow you to include more nutrient-rich foods in your diet without risking hyperkalemia. Balancing the risks and benefits is essential. Overly restrictive diets can lead to malnutrition and weaken your health, so your medical team will aim for a balanced approach. They will consider your blood tests, medications, and overall health to develop a plan that keeps your potassium safe while supporting your nutrition. Always remember, managing potassium in kidney disease is complex and highly individual. It's important to follow your healthcare provider's advice and not try to manage your diet alone. Self-managing without professional guidance can be risky, especially if your condition changes. Regular checkups and blood tests are your best tools to stay on track. In summary, managing potassium intake with kidney disease involves a careful, personalized approach. It's about finding the right balance, enough to nourish your body but not so much that it causes health problems. Recent guidelines support a flexible, individualized plan that considers your specific situation. This approach helps protect your kidney health, supports your heart, and can improve your overall quality of life. Always consult your healthcare team for tailored advice, and remember that proper management can make a big difference in living well with kidney disease.